Good day, welcome to our rationalization for Nloa 1 semifinals, and this covers E1, E2, and E3. Let's begin with our first question, which is actually focused on care of pediatric clients with neurologic disorders. Number 1, during hospitalization, a child experiences a tonic-clonic seizure. To provide for the client's safety, which of the following actions should the nurse take? The correct answer here is letter B. Because during a generalized tonic-clonic seizure, maintaining airway patency and ensuring adequate oxygenation are highest priority, and jaw thrust maneuver safely opens the airway without hyperextending the neck, and supplemental oxygen helps counteract hypoxia caused by rigid respiratory muscles. Letter A, never force anything into a seizing patient's mouth. Padded tongue blades can fracture teeth, lacerate oral tissues, or break and completely occlude the airway. Letter C is also wrong because restraining the child during a seizure can cause musculoskeletal injuries such as fractures or severe muscle strains. And intramuscular benzodiazepine are not the immediate emergency treatment for an isolated short-lived tonic-clonic seizure. Rapid-acting anticonvulsants such as diaphragm are reserved for status epilepticus or seizure lasting for more than 5 minutes. Number 1, the answer is letter B. 2. Post-operatively, for a placement of a shunt for hydrocephalus, the nurse should place a child in which of the following position? Number 2, the answer here is bravo. And because post-operatively a child will receive a ventricular or VP shunt, should be kept in flat bed and position on an unoperated side. Keeping the bed flat minimizes gravity-induced rapid drainage of cerebrospinal fluid, preventing subdural hematomas from sudden brain collapse. Positioning the child on the unoperated side protects the newly implanted shunt valve mechanism from structural damage and localized skin breakdown. Elevating the head 30 to 45 degrees too soon causes rapid excessive CSF depletion from the ventricles. That's eliminated. And letter C is also eliminated because placing the child directly on the operated side risks damaging the shunt hardware and places pressure on the fresh surgical incision. Number 2 is letter B. 3. The parents of a 2-year-old child or 2-year-old toddler has cerebral palsy. Notice the child does not sit up alone. They ask the nurse whether the child will be able to learn to walk alone or with crutches. Which of the following is the appropriate response by the nurse? Number 3, the correct answer is letter A. Because motor functions are strong prognostic indicators for future ambulation in children with cerebral palsy, voluntary sitting balance requires coordinated trunk control. Clinical data demonstrates that if a child with CP cannot sit independently by 2 years of age, their long-term potential for functional independent ambulation is extremely poor. Choice B and D provides unrealistic expectations and false hope to the parents, as failing to sit by age 2 indicates significant widespread involvement of voluntary motor pathways. And then letter C, while every child develops at an individual pace, this non-committal answer ignores established developmental indicators. 3. Alpha. 4. The parents of a child with cerebral palsy ask the nurse what the most common cause of cerebral palsy is. The most appropriate response by the nurse is which of the following? The answer here is Charlie. Statistically, a prevalent risk factor for the development of cerebral palsy is prematurity, with gestation of less than 37 weeks and very low birth weight of less than 1,500 grams. The fragile underdeveloped blood vessels in the brain of a premature infant are highly susceptible to periventricular leukemia, leukomalacia, and intraventricular hemorrhage, leading to permanent motor cortex damage. Number 4 is Charlie. 5. When caring for a child with meningitis, it is essential that the nurse evaluate for a positive Brzezinski sign, which would indicate the best answer is bravo. Because Brzezinski sign is an objective clinical indicator of meningeal irritation, typically seen in bacterial viral meningitis. When the nurse flexes the child's neck forward while they are in a supine position, an involuntary flexion of the hips and knees occurs. This is a protective reflex intended to minimize painful stretching of the inflamed spinal cord and also the meninges. ACD, increased intracranial pressure. encephalitis, and at the same time, intraventricular hemorrhage can cause neurological changes, but they do not specifically trigger Brzezinski sign unless concurrent meningeal inflammation is present. 5 is Bravo. 6. A nurse is providing discharge instructions to parents of a child who suffered a head injury 6 hours ago. Which statement by the nurse would indicate additional teaching is needed? Correct answer is Charlie. Because after a head injury, a child must be closely monitored for signs of increasing intracranial pressure or evolving intracranial hemorrhage. Parents must be instructed to awaken a child every 1 to 2 hours to evaluate their level of consciousness, pupil reactivity, and verbal or motor responsiveness. Allowing uninterrupted sleep prevents the early detection of neurological deterioration. 6 is Charlie. 7. The nurse is assigned to administer bismuth subsalicylate or pepto-bismol to a 10-year-old child who has Reyes syndrome and is experiencing gastrointestinal clinical manifestations. Which of the following is a priority action for the nurse to take? Answer for 7 is Delta. We know that Reyes syndrome is a life-threatening pediatric condition characterized by acute encephalopathy and fatty liver infiltration, which is strongly linked to administered salicylates or aspirin during a viral infection. Because bismuth subsalicylate contains salicylates, administering it to a child with suspected or diagnosed Reyes syndrome can exacerbate hepatic toxicity and is extremely contraindicated. The nurse must question this order immediately. 7. Delta. 8. The nurse assesses cranial nerve 7 in a pediatric client by which of the following technique? Answer is Alpha. Swabbing the cornea with sterile cotton trigger. Applicator triggers the corneal reflex, which tests the sensor component of cranial nerve number 5, which is trigeminal nerve, and the motor component of cranial nerve number 7, which is facial, which controls eye blinking. B. Does eye oculocephalic reflex evaluates cranial nerve 2, 3, 4, and 6. And caloric testing or oculovestibular reflex evaluates cranial nerve 3 and 8. And irritating the pharynx evaluate the gag reflex managed by cranial nerve number 9 or the glossopharyngeal and cranial nerve number 10 or the vagus nerve. 8. Alpha. 9. When an infant who has anencephaly, the most appropriate nursing intervention is 2. Correct answer is Delta. Because we know that anencephaly is a fatal neural tube defect characterized by congenital absence of the major portion of the brain, skull and scalp, while the primitive brainstem may be preserved enough to support temporary spontaneous respiration and cardiorespiratory actions at birth. Respiratory failure and death are inevitable within hours or days. Supportive palliative nursing care and compassionate parental grief support are the primary focus. 9. Delta. 10. When planning a client assignment for the day, which of the following nursing tasks would be appropriate for the registered nurse to assign to an assistive personnel? Correct answer is Charlie. Because a registered nurse can only delegate stable routine tasks that do not require clinical assessment, judgment, or interpretation or patient teaching. Measuring and documenting a physical parameter like temperature via an automated route is a standard technical skill well within the scope of practice for assistive personnel. Number 10 is letter A. 11. Should the following statements indicates a family of a child with a seizure disorder has followed the nurse's discharge instruction? 11. The answer is Alpha. Because pediatric anticonvulsant dosing is calculated strictly by body weight during periods of rapid skeletal growth and weight gain, serum drug concentrations can drop below therapeutic thresholds, leading to breakthrough seizures. Scheduling an appointment to titrate the medication dose during a growth spurt shows an excellent understanding of long-term seizure management. 11. Alpha. 12. The parents of a child suspected of having a shunt malfunction ask the nurse what caused it. The appropriate response by the nurse is which of the following? Best answer, Alpha. Because hydrocephalus occurs due to an imbalance between CSF production and absorption, a shunt system redirects excess CSF away from the brain's ventricles to another body cavity, usually the peritoneum. A shunt malfunction means CSF flow is obstructed, causing fluid to back up in the ventricles, raising intracranial pressure, and reproducing hydrocephalus symptoms. That's the end of the first part. Let's proceed now to E2, care of pediatric clients with vision and hearing disorder. Number 13. A mother brings her infant to the clinic for a 9-month well-baby exam. She expresses concern to the nurse that her infant's soft spot in the front is still palpable. The nurse's response would be based on the understanding that anterior fontanelle closes. Answer: bravo. Before 18 months of age. The anterior fontanelle closes between 12 and 18 months of age, with the average timeline sitting at approximately 14 months. Finding a palpable anterior fontanelle in a healthy 9-month-old infant is a normal physiologic finding. The nurse should document the size and ensure head circumference follows a normal growth curve. 13. Bravo. 14. A 5-year-old girl presents for vision screening. A screening using a HOTV chart is completed with the following results: 10-15 right eye, 10-12.5 left eye. We should follow interpretations by the nurse is correct. 14, the answer is Charlie. For a 5-year-old child, visual acuity of 10 or 15 or better, or 20/30 on a standard scale in both eyes without significant two-line discrepancy between eyes represents passing screening results, and no specific ophthalmology referral is indicated. 14 is Charlie. 15. On testing, a 3-year-old boy is found to have left esotropia. The physician directs the nurse to instruct the parent on patching to treat the strabismus. The nurse should instruct the parent to. 15. The correct answer is alpha. In order to treat strabismus or misaligned eyes in this case, left esotropia or crossed eye, occlusion therapy such as patching is applied directly over the stronger unaffected right eye. Forcing the brain to rely solely on the weaker left eye simulates the visual cortex and strengthens the extraocular muscles of that eye. 15. Alpha. 16. In addition to instructing the mother on patching, the nurse informs her that it is important that the strabismus was recognized before the age of 6 years. This reflects the nurse's understanding that untreated strabismus may result in myopia, stigmatism, or amblyopia or hyperopia. The correct answer is letter C. If strabismus is left untreated during early childhood before the visual pathways mature or completely around age 6, the brain will permanently suppress the double or blurry images coming from the misalignment eye. This chronic suppression leads to amblyopia or lazy eye, resulting in irreversible vision loss or cortical blindness in that eye. 16. Charlie. 17. To pass pure tone audiometry testing, the nurse understands that a child should be able to hear a frequency of 500 Hz at how many decibel? The correct answer is bravo. Standard pure tone audiometry screening protocols direct or dictate that the child must reliably detect tone across various frequencies including 500, 1000, or 2000, or even 4000 at a sound volume threshold of 25 decibels. Failing to hear these tones at 25 decibels in either ear constitutes a failed screening and requires a formal audiology evaluation. 17 is bravo. 18. An 18-month-old child is to have a tympanogram. The mother asks what that is, which of the following statements by the nurse best describes the purpose of tympanometry? Answer is letter A. Tympanometry is an objective diagnostic tool that uses a specialized probe to vary air pressure within the ear canal, measuring the compliance or mobility of the tympanic membrane, and checking for middle ear effusion. A flat tympanogram curve suggests fluid behind the ear or there's presence of otitis media. 18 is letter A. 19. A 2-year-old boy is sent home from a daycare because of red itchy eyes. The nurse notes mucopurulent discharge from both eyes, and the physician treats the boy with antibiotic eye drops. The nurse provides discharge education, recognizes a need to repeat instruction when the mother states. 19. The correct answer is delta. When cleaning an infected eye with discharge, the nurse should instruct the parent to wipe from the inner canthus near the nose downward and outward towards the ear. This technique prevents cross-contaminating the lacrimal duct or spreading pathogens to the opposite eye. The parent statement that they will wipe from the outer corner inwards requires immediate intervention. 19 is letter D. 20. The nurse evaluates which of the following laboratory tests and pathogens to cause otitis media in children. Answer, Charlie. The vast majority of acute otitis media infections in pediatric patients are caused by upper respiratory tract pathogens that migrate up the eustachian tube. The two most common bacterial isolates are Streptococcus pneumoniae and non-typable Haemophilus influenzae. 20. Charlie. 21. The mother of a 9-month-old infant calls the triage nurse with a concern that her child who has a bad cold might have an ear infection. The triage nurse elicits additional history which of the following can be identified from the health history as a risk factor for the development of otitis media in children. 21. The answer is alpha. Because daycare attendance significantly increases our child's risk of developing otitis media due to constant exposure to high density of peer respiratory pathogens combined with an underdeveloped immune system. 21 is alpha. 22. A 3-year-old boy is accompanied by his mother for follow-up of fluid in his middle ears. He has a bilateral ear infection 3 months ago, and the fluid is in middle ears. Has it persisted at all of his subsequent appointments? The nurse, based on the understanding of bilateral middle ear effusion, recognizes that this child should be 22 answer. Bravo. Chronic otitis media with effusion lasting for 3 months or longer places the child at high risk for persistent conductive hearing loss. Because fluid dampens sound waves transmission across the ossicles, these fluids must be monitored with a formal hearing test to prevent delays in speech, language, and cognitive milestones. 22. Bravo. 23. A 5-year-old female has received tympanostomy tube. The discharge nurse instructs the parent and child regarding tympanostomy tubes and their care, which of the following would be included in the education plan. 23 answer, Delta. Tympanostomy tubes or pressure equalizing tubes create a direct opening through the tympanic membrane to prevent non-sterile water from entering the middle ear cavity, which introduces pathogens and reduces surface tension, especially when mixed with soap. Earplugs are highly recommended during swimming, diving, bathing, and shampooing. 23. Delta. 24. A 12-year-old child has experienced repeated otitis externa. The child swims daily on a swim team and is unwilling to give that up. The nurse instructs the child and parents on methods to prevent further effects of which of the following is included in the plan. 24. Charlie. We know that otitis media or swimmer's ear is an infection of the external ear canal often caused by trapped moisture that alters the canal's natural acidic pH, creating an opportunistic environment for bacteria like Pseudomonas. Instilling a 50% solution of white vinegar, acetic acid, and water after swimming reestablishes an acidic environment that inhibits bacterial growth. 24. Charlie. 25. A 6-year-old child is scheduled for tonsillectomy. The nurse is obtaining the preoperative history because of this risk associated with the surgery. The nurse should report which of the following to the surgeon. Answer, alpha. The palatine tonsils are highly vascular structures supplied by multiple arteries. Post-operative hemorrhage is a severe life-threatening risk following a tonsillectomy. Any family history of bleeding disorders or bleeding tendencies such as hemophilia or von Willebrand disease requires a preoperative evaluation including a coagulation profile. 25. Alpha. Let's now have the last part, which is care of pediatric clients with musculoskeletal disorder. 26. A 6-year-old with newly diagnosed juvenile idiopathic arthritis complains of joint stiffness in the morning. Which of the following? What is the most appropriate intervention? Answer, Delta. Morning stiffness is a classic manifestation of juvenile arthritis. Taking a warm bath or shower immediately before school helps vasodilate blood vessels, relax surrounding muscles, and decrease joint stiffness, improving joint mobility for morning activities. 26 delta. 27. A child in a spica cast for developing dysplasia of the hips cries during diaper changes. What's the nurse's priority? 27 alpha. A child immobilized in a large hip spica cast is at high risk for skin breakdown, particularly around the perineal cutoff, where urine and feces can collect. Crying during diaper changes indicates pain from potential skin irritation, friction rubs, sorry, or hidden pressure ulcers beneath the cast edges, requiring an immediate head-to-toe skin and neurovascular assessment. 27 is alpha. 28. A child with osteogenesis imperfecta is hospitalized. What action reflects the nurse's understanding of the condition? Of course, the correct answer here is letter B. Use a lift sheet when repositioning, because osteogenesis imperfecta or brittle bone disease is a genetic disorder characterized by defective collagen synthesis, leading to extreme bone fragility and recurrent fractures from minimal trauma. Using a lift sheet when repositioning, the child distributes weight evenly, minimizing pressure points and preventing accidental bone fractures during basic care. 29. Which finding requires immediate intervention in a child with cast for a fractured femur? Answer, Charlie. Because severe pain that is unrelieved by narcotics or analgesic is the most significant early warning sign of compartment syndrome. This is a medical emergency when increased pressure within a muscle compartment comprises local blood flow, risking permanent tissue necrosis and nerve damage. 29. Charlie. 30. A nurse is teaching a parent about scoliosis bracing. Which assessment by the parents indicates effective teaching? Answer, Bravo. To stop the progression of spinal curvature in a growing child with scoliosis, a corrective brace like Boston or Milwaukee brace must be worn continuously for 23 hours a day. It is removed only for 1 hour for bathing and skin checks. 30. Bravo. 31. A child with muscular dystrophy has difficulty climbing stairs. What's the nurse's best response? Answer, Bravo. Duchenne muscular dystrophy is a progressive X-linked inherited disorder characterized by a gradual muscle degeneration. Difficulty climbing stairs is a classic manifestation as proximal pelvic muscles weaken. Validating that this is an expected progression of the disease while focusing on home safety provides realistic support to the family. 31. Bravo. 32. When educating parents of a child in skeletal traction, which instruction is most important? Answer is C. For skeletal traction to work effectively, the weights must hang freely at all times, and the ropes must remain aligned within the pulleys. Touching, bumping, or lifting the weights disrupts the continuous pulling force, alters bone alignment, and can cause severe muscle spasm and pain in the fractured side. 32. Charlie. 33. A child with slip capital femoral epiphysis complains of knee pain. What is the nurse's initial assessment? Answer is letter D. Because slip capital femoral epiphysis is a condition where the femoral head slips out of the place at the growth plate. It frequently presents as referred pain to the knee or groin, often obscuring the underlying problem. Assessing hip range of motion, which typically shows restricted internal rotation, is the necessary first step to uncover true source of the pain. 33. Delta. 34. Which goal is priority in a care plan for a child with cerebral palsy? Answer, Alpha. The primary goal for a child with cerebral palsy is to promote the maximum development of motor function and independence. Because cerebral palsy is a permanent, non-progressive brain disorder affecting movement, intervention should focus on early physical therapy to optimize locomotion and self-care skills. 35. A nurse is caring for a child with leg calf orthosis disease. Notes that the child has been non-weight bearing for several weeks. What is the best next step in care? Answer, Bravo. When I say leg calf leg calf pertis disease involves a vascular necrosis of the femoral head. Treatment requires keeping weight of the joint to allow the femoral head to revascularize and remodel without flattening. The nurse must instruct the family to continue strict activity and weight-bearing restrictions until evaluated by the orthopedic physician. 35 is Bravo. 36. A 4-year-old with clubfoot has a series of casting interventions. What should the nurse emphasize to parents? Answer, Charlie. The primary treatment of congenital clubfoot is the Ponseti method, which relies on weekly series of manual manipulations and long leg plaster cast applications. The nurse should emphasize that each cast change gradually stretches the tight ligaments and aligns the foot forward or toward a normal position. 36. The answer is Charlie. 37. Which finding is most concerning in a child with the suspected Duchenne muscular dystrophy? Answer, Delta. Because we know that Duchenne muscular dystrophy typically manifests early in childhood with noticeable muscle weakness, appearing between ages 3 and 5. Finding a child who is losing the ability to run or display normal motor skills at age 5 is highly concerning, reflecting progressive pelvic, girdle, and proximal muscle wasting. And that is it. Thank you so much for listening.